My name is Samia Mora. I'm an associate professor of medicine at Harvard Medical School and the director for the Center for Lipid Metabolomics at the Brigham and Women's Hospital. I just gave a presentation on aspirin for primary prevention of CVD at the 22nd Annual Scientific Sessions of the World Congress on Heart Disease. My talk mostly consisted of describing the latest guidelines from 2016 from the U.S. Preventive Services Task Force. In 2016, the U.S. Preventive Services Task Force updated their guidelines for the use of low-dose aspirin for prevention of cardiovascular disease and colorectal cancer. And those guidelines can be summarized in 3 points. The first point being that individuals younger than age 50 or older than age 70, there was insufficient evidence to recommend or not recommend aspirin. So this was considered insufficient data. For individuals between the ages of 50 and 59, they were given a recommendation B, meaning that these individuals could get aspirin for primary prevention for ASCVD as well as colorectal cancer if they met the 4 criteria. 1, their ASCVD or atherosclerotic cardiovascular disease risk, that is their risk for myocardial infarction, stroke, or cardiovascular death over the next 10 years, if that was 10% or more, so that means more than 1% per year, they would be considered for aspirin for primary prevention if, in addition, they were willing to take aspirin for 10 years. They were also had no increased risk of bleeding, in particular for GI bleeding, but that also includes patients whose blood pressure should be well controlled, as well as having no prior, especially recent GI bleeding, gastrointestinal bleeding. And also, if they were willing and able to take aspirin daily. Now, in some cases, patients can be given aspirin every other day, but the benefits for colorectal cancer prevention really start to accrue if you take it every other day after about 10 years, versus if you're taking it daily, the potential benefit for aspirin reducing colorectal cancer incidence is about 5 years or so. Now, in addition, the U.S. Preventive Services Guidelines highlighted that the risk really should be individualized for individuals who are between the ages of 60 and 69. So individuals who are between ages 60 and 69, they got a recommendation C, meaning individualized decision, and that decision should be carefully weighed with the healthcare provider who is taking care of the patient, in addition to the cardiovascular risk of the patient, as well as their bleeding risk. And the U.S. Preventive Services Task Force recommends individualizing the risk in general for any of the patients who take aspirin for primary prevention, because aspirin has side effects, in particular GI bleeding, gastrointestinal bleeding. So in order to make this more accessible for healthcare providers, together with my colleagues, Dr. Joanne Manson and Jeffrey Ames, we put together a freely available mobile aspirin guide. This is a clinical decision, a shared decision-making tool so that patients can discuss with their healthcare providers the use of aspirin for primary prevention for cardiovascular disease in particular, but it also takes into account the reductions of aspirin for colorectal cancer. And this guide is freely available on the website on www.aspiringuide.com. And we also have it available for Apple Android products. It is free, not commercially supported. And in it, the app actually has internal calculators for both bleeding risk as well as for risk of cardiovascular disease, so that then the healthcare provider can weigh the benefits and risks of aspirin for reducing risk of CVD as well as for potential increased risk of bleeding. And this can be very useful for discussions with the patient regarding whether or not they should be recommended aspirin for primary prevention of cardiovascular disease, and potentially take into account also reductions for colorectal cancer. and other gastrointestinal cancers, while at the same time giving the patient an estimate of their bleeding risk. So in summary, aspirin for primary prevention, meaning individuals who do not have prior cardiovascular disease such as heart attack or stroke, but who want to prevent their first heart attack, stroke, or potentially even cardiovascular death, these individuals should be have a very careful discussion with their healthcare providers regarding the risks and the benefits of aspirin. While aspirin has reductions for risk of heart attack and ischemic stroke, including total stroke, it does increase risk for hemorrhagic stroke, small but significant, and also for GI bleeding. And these risks should be balanced. And in appropriate individuals, they could potentially benefit from aspirin for primary prevention of cardiovascular disease and cancer, in particular colorectal cancer. However, patients should be aware that aspirin does have certain risks, and in particular, older patients, in particular above age 70, should be very careful as their risk for bleeding may be higher than younger individuals.